Bonding tooth-colored plastic to teeth has been one of the most useful clinical techniques in the history of dentistry. It's been around for several decades now. It's well proven. It's an easy, fast, relatively inexpensive technique that provides excellent appearance, good service longevity, and almost no removal of tooth structure. I know you're interested in that. This video will explain to you how bonding works and show you the various conditions in which bonding provides a beautiful result. The following images will show you how the space between those two front teeth was closed. The teeth are cleaned with a pumice-like material, sandy material. A plastic form is placed between the teeth to aid in the technique, and the surface of the tooth is roughened by a very weak acid, much like the acid that's contained in a cola. The roughness holds the tooth-colored plastic on the tooth surface. The putty-like plastic material is placed onto the roughened tooth surfaces. The dentist contours it. The putty-like plastic is hardened by various methods, often a light, sometimes not a light, and smoothed to appear as you see it in this image. Now look at the before and the after images and see if you can detect where the plastic starts and the tooth ends. And all of these procedures are really quite simple, and they were produced in just a few minutes, painlessly and at a moderate cost to you, and for quite a few years of expected longevity. I know it's confusing to you because there are a few major alternatives to bonding. They include veneers, little thin pieces of plastic or ceramic on the surface of the tooth, crowns, which are caps to you that sit down over the tooth, whitening of the teeth with just chemicals, or moving teeth with orthodontic therapy. Veneers, crowns, and orthodontics are usually several times more expensive than bonding, and they require longer treatment time. However, the service longevity of all three of those techniques is usually longer than bonding. Whitening is very simple and inexpensive. If the teeth are sound, your dentist may suggest only whitening. We're now going to look at veneers and crowns and see if you understand those and if they might solve your situation better than bonding. As you can see, a veneer is just a piece of ceramic or plastic on the front and the biting edge of the tooth, with most of the enamel still remaining. As you observe this image, you will see three veneers that have been done on three defective bonded teeth, and you'll see how nice those ceramic veneers appear. You're observing some defective crowns of metal or ceramic. They have decay around them. Let's remove them, and you'll see how much of the tooth has been removed to make room for a crown or cap. The laboratory technician then makes the crown, and they're seated in the mouth. They're absolutely beautiful, long-lasting, but extremely expensive when compared to bonding. What else? Additionally, movement of teeth with orthodontic therapy or braces often will correct the unsightly appearance of teeth that are crooked or malpositioned. Your dentist can tell you if orthodontic therapy will satisfy your situation better than bonding. However, bonding is the least expensive, the most conservative, and if it is appropriate, bonding is probably the best. Bonding, or attaching pieces of plastic to roughened teeth, is used for teeth that have decay in them, but also to correct teeth that may not have decay, but have spaces between them, unequal lengths, poor positioning in the dental arch, poor shape or wear, discolorations or fillings, and gum recession showing root surfaces. The following before and after images may be the same as the situations in your own mouth. Let's discuss each situation. You're observing spaces between teeth. Often they can be corrected by orthodontic therapy or braces. If that's not indicated, As in the adult patient you are now observing, spaces between teeth may be simply and rapidly closed by bonding plastic to the sides of the teeth next to the space. Multiple spaces may also be closed if you desire to do so. Often, one or more teeth come into the mouth appearing to be shorter than the surrounding teeth. Sometimes braces can correct that, but sometimes they can't. The patient you are now observing had short and spaced teeth. Both situations were acceptably corrected by bonding. One of the alternatives to correct crooked, worn, or broken teeth is simple bonding. The patient you're observing has all three conditions on his upper front teeth. They're crooked, worn, and one has been broken off. The unsightly condition has been corrected by placing a simple layer of plastic over the front surfaces of the 4 upper front teeth. Occasionally, Mother Nature is not kind to us and either a tooth doesn't develop or they do develop and they're the wrong contour. The patient you're now observing is a 17-year-old girl who has a missing upper front tooth, never formed, and misshapen remaining upper front teeth. The upper teeth have been built out to normal contour by bonding, thereby allowing her to develop physically, have a dental implant placed in the missing tooth location. Bonding will last several years, even in this extreme case. Often, teeth become discolored after root canal therapy or because previously placed fillings have degenerated and caused an unsightly appearance. The patient you're observing has one upper front tooth with a discolored plastic filling in it. That happens to plastic fillings often. They run for several years before they finally degenerate. Replacement of the filling with a bonded plastic restoration or filling has made this patient look completely normal. You're observing a patient about 35 years of age. As all of us become older, the gums shrink and recede, exposing the root surfaces of the teeth. In some patients, this shrinkage causes an unsightly appearance, as you observe in this image. Bonding small pieces of plastic into the spaces between the lower front teeth has provided a normal appearance for this patient, and also has allowed her not to collect food in those black spaces that you see between the teeth. Bonding's been available to you for many years. These beautiful restorations are almost undetectable from tooth structure when done properly. They're easily placed. Even a neophyte dentist can place these. I've had dental students place them very well. They're conservative. They don't take away a lot of your tooth structure. They're nearly painless, even during the procedure and subsequent to it. The restorations are just a fraction of the cost of a cap or a veneer. But if they're placed too thickly, they can be weaker. Therefore, ask the dentist if your situation is best suited to bonding. Consult with the dentist about your own situation. Bonding may be just one of the answers. You may have other alternatives that could be as good or even better. If bonding is indicated, I am sure that you'll be satisfied with these excellent restorations.